we'll give them a chance to introduce themselves as they speak. Right now, Montgomery County stands at 2,956 cases. We are 11% of all positive COVID-19 cases in the state of Alabama. 1,099, nearly 40% of these cases have come in the last 14 days. We've had 71 deaths total in Montgomery County. Montgomery County makes up 9% of Alabama COVID-19 deaths. Between May 1st and May 31st, Montgomery's total cases increased by a whopping 382%. We went from 355 cases to 1,710 cases. Halfway through June, we've already increased by another 73%. We've gone from 1,710 cases to 2,956 cases of COVID-19 just in the county alone. In light of this information and these numbers, we felt the city should have taken official action last night to implement a facial covering requirement for the city. As you know, we've been encouraging our community to wear masks and any type of facial coverings for a number of months. And most of our community has done just that. They've also been practicing social distancing. However, not enough members of our community have done those things. And so we started to go from an encouragement to an enforcement phase, and we discussed the potential of mandating facial coverings in all public spaces. This was something that we hope would just get the attention of our community to get more and more people to do that. However, while some did, we still had a sizable chunk of our population which chose not to do that. And we understand. Some people are uncomfortable, some people were not sure about the medical information, and some people just did not want to see it done. However, we held off on bringing forth any ordinance at that time in hopes that our numbers would plateau, possibly even decline. Instead, what we've seen post-Memorial Day has been a surge unlike many other communities. And so with that, Councilman C.C. Calhoun decided to introduce an ordinance last night at the council meeting. I want to thank him for his courage, for his leadership, and for his compassion in doing so. We also want to thank the other council members who voted for this ordinance. Councilmember Clay McInnes, Audrey Graham, and Aronde Mitchell. We're thankful for their support. However, we had 4 councilmen that opposed this measure, as was their right. We also had a council member who was not present last night. So we deadlocked at 4-4 and were not able to move the ordinance forward. But this issue is too important, and the facts speak far too loudly for us not to take action. Our goal is to try to help this community get to a point where we can fully reopen in all phases, where we can fully be comfortable doing many of the things that we did prior to this pandemic, shutting down not only Montgomery, the state of Alabama, but this entire nation and many parts of the world. And so our goal here is to make sure that people are wearing some sort of facial coverings, whether that be a mask, whether it be a cloth, whether it be a bandana, something that will slow the spread of COVID-19, as was mentioned last night. Our city council representatives have masks available to distribute to all of our citizens. If we run out, we'll get some more. We want to make sure everyone has the option to get a mask if they do not have one. But if you don't have a mask, then certainly you can just use any type of cloth or facial covering as well. So we'll be giving away masks at city facilities in the upcoming days. Therefore, today, I'm announcing that I'll be signing an executive order implementing a facial covering requirement in Montgomery, Alabama. And I'm doing this for one simple reason. After listening to our health experts and warnings they've continued to give us, we're doing this today because it's the right thing to do. Introducing this executive order in the hopes that in a few weeks after July 4th, when the City Council comes back, we can revisit this issue at that time. Right now, I want to ask Councilman Glenn Pruitt if he will come and share just a few words and thoughts with you regarding this executive order. Councilman Pruitt.
Hey, good afternoon. I had a whole list of things I wanted to talk about, but when car trouble happens and you leave your list in the car, it doesn't turn out too good. Mayor, I appreciate you letting me give me the opportunity today to come speak. I want to thank y'all and want to apologize to y'all. Last night we had a vote for an ordinance for mandatory mask in the city of Montgomery. My opinion was that I was very nearsighted last night. I didn't see the big picture. And I'm going to tell you how I got to this point. All I was looking at was the enforcement of the ordinance. I was so concerned about that, how it wouldn't work. I did not see the big picture of where we needed to be. When I went home last night, I did a lot of thinking, and I called my wife this morning while I was working. And I asked my wife, did I mess this vote up last night? And her words to me were, if Courtney Pruitt were alive, you would have voted for it. And that's the honest to God truth. I would have sponsored it. So I asked myself, why could I not see the forest last night for the trees? Because I was so nearsighted. These doctors came to us last night and told us everything that we needed to hear. And if any one of us in this room went to them today with the condition, we would do exactly what they asked us to do. We didn't do that last night. So what I want to commit to the mayor and to the city, and listen, it's a mask. That's it. If I could have had my daughter back for one more day, you better believe I would have voted for a mask. So let's do it. Let's see where it gets us, and we'll revisit it. So over the next couple weeks, Mayor, I'd like to work with CC or Rondé. I'd like to work with Richard. I would like to find us an ordinance that everybody can agree upon if we need it at that time. With your order, maybe in July, we don't need it. Who knows? That's the best case scenario. But we, as Montgomeryans, and let me share this with you. This is not a black issue. This is not a white issue. This is not a Democratic issue. This is not a Republican issue. This is a Montgomery issue. And we need to come all together to fix this. We as Montgomeryans. So I appreciate the opportunity, Mayor, to come down here and let me speak what was on my heart. But out of 17 years, I've voted on a lot of things. This is the one that's given me the most problem because I knew what I would have done differently had circumstances been right or different. So why not do it even though she's not here to save somebody else's life? So that's what we're asking everybody is to mask up. Let's get through it, move on, and get back to normal. Thank you, Mayor, and thank y'all, and I apologize again to you guys.
If I can say one thing this time, if there were more people like Glenn Pruitt in public service, we get a lot more things done, not only our city and our community, but this state and this nation would be better off. One of the hardest things for people to do in leadership often is to admit that they would like a do-over, that they like a second chance, that they would maybe like to rewind things. We don't always get to do that in this world with everything being so instant, but I appreciate Councilman Pruitt's sincerity. I appreciate his support, and I appreciate his wife and his family's thoughts about those in this city and this community. That's what we need more of and that's what we seek to do as a body. We don't always get it right, but we try our best to make sure we're doing things in the best interest of the people, even sometimes in spite of ourselves. And I'm no different, and I just want to thank Councilman Pruitt for sharing that and committing to work with us on an order and supporting this executive order. At this time, I want to ask Dr. Salisky and Chief Medical Officer Dr. McIntyre if they would come up. And I want to start by saying I don't know that we would be here without our medical experts sharing with us what they're seeing, sharing with us their knowledge of what is currently happening in our hospitals, the impact it's having on individuals and their families. Dr. Salisky, your words last night echoed across the country. They reminded us of just how important this situation is and how vital it is for all of us in these positions in leadership to take action. And so at this time, Dr. McIntyre, I'm going to start with you as the Chief Medical Officer for the Alabama Department of Public Health, and I'm going to ask Dr. Salisky if he would come and say a few words after that. Thank you.
Good afternoon. My name is Mary McIntyre, and yesterday I think I made people understand, I hope, how important this is to all of us. I'm a physician, but I'm also a mom, I'm a wife, been married for over 43 years now. I have grandchildren, I have great nieces, nephews, and I have a lot of friends. On last week, I lost 2 of them to COVID-19 within days of each other. There was a funeral on Saturday that I didn't attend because I talked with my husband about the potential, even though it was a graveside funeral, about the fact that people don't always do what they're supposed to do when it comes down to social distancing. We have a tendency to hug each other. We want to gather and comfort each other. And I didn't think that was something that we needed to do because I was worried about actually creating more of a problem with spreading the disease. And we had our friend whose sister it was call us the next day to tell us, because we had indicated that we made sure that they knew we wouldn't be there, but we also wanted them to know that in spirit we were, and we would be coming to their house to see them, and they called to tell us, don't do that. They said we were actually exposed or in contact with a number of people. We don't know whether we're potentially infected or not. We don't want you to take that risk. Give us 2 weeks, let us self-isolate, quarantine, and then come see us. And you know, those are friends. Those are people that really think about how important it is for us to do the right thing. We know what to do, all of us. We know that we need to protect ourselves. I said before, and I put it on Facebook with family and friends, my house remains closed, our house. We have not opened the doors for people to come and go as they want to. I have a 12-year-old grandchild there and my daughter that lives with us. They understand what the rules are. They can't go out and about and do other things, but they're really careful about where they go and that they are always wearing a face covering. They've got disinfectants in the car, hand sanitizers in the purse, all of those things that all of us can do to protect ourselves and our families. We can stay away from people. If we have to wave at them at a distance, wave at them. The whole thing about the hugging that we all are inclined to, I'm one of those people that love to hug folks and to kiss people on the cheek. But guess what? I stopped all of that. I wear my face, a mask, anytime that I'm outside of my home or office. If I'm in the office and I don't have anybody else in my office, I take off my face mask. Okay, I do a good thing with cleaning my hands, frequently washing. I walk around with these alcohol wipes that I clean surfaces with that other people might have touched, like the buttons in the elevator, for instance. But we need to get in the habit of doing that. And I just touched my face over here, y'all. I got an itch, but sanitized before I did that, and I didn't touch anything else. That's the extremely most important thing we have to remember. We can protect ourselves and we can protect others. We have to remember that, yes, there have been some really serious consequences. There have been some unprecedented things that none of us probably ever expected to see in this lifetime. I know I didn't, that we've had to deal with. But we will make it through this if we all work together to do it. It's extremely important that it's not just about protecting ourselves, but about protecting others. The thing that I said about one of my friends who actually made it out, she was in the hospital for weeks. She called and asked me some questions that I answered while she was there. She managed to stay off the ventilator, but her son or nephew was so scared that he had killed her that he called her crying and boohooing when they didn't think she was gonna make it. Don't be that person that has to say, I wish I had done this in order to protect someone else. Think about what those consequences are. And like I told her, I said, well, a lot of people think that it's not gonna happen to them or to anyone that they know or anyone that they love, but we're all in this together. And just like he didn't expect to be the one to give the infection to her and that she spent all that time in the hospital, but she made it, some others haven't made it, like the two I mentioned early on that died last week. So we're not over this yet, and we're working on some stuff to get out so that people can get reminders that embrace the mask. I call it embrace the face covering. If all you got is a scarf to put around you, it works, it helps, use it. If you want to know how you can do more in your home, just get in the habit of disinfecting those light switches and those frequently touched areas regularly so that you're not dealing with bringing in additional soil and dirt. And that's pretty much it. From a public health standpoint, we all know that there are things that we can do that make a difference. And the most that we know that works is the social distancing, staying apart, not getting in groups and gatherings, making sure that we're doing what we need to do to keep our hands clean and keep our hands off our face. And the other thing is making sure that we do wear face coverings, because those are all things that now been proven to actually reduce the risk of transmission. Thank you.
Dr. Salisky, Dr. Garrett, if you all would like to bring any words at this time, may do so. Dr. Garrett.
Good afternoon. I am Dr. Nina Nelson Garrett. I'm a gastroenterologist here in Montgomery, so I'm here representing the private practice doctor. Mask wearing to me is an ethical issue. When we talk about ethics, we talk about doing the greatest good for the greatest number of people. So what we're looking at is, how do we help our entire community? We all want to remember that our personal liberties are important, but when we're in a pandemic, we have to think about our community as a whole. So a face mask, a simple covering, it's just so important and something easy to do to mitigate this disease. And we're not talking about for a long period of time, as long as it takes for us to curb this, to get our curve to go down. And so I'm honored that the mayor is doing this executive order because it's needed. Our hospitals are in need of assistance, and the public can help. So we thank you, and remember, you love your neighbor as you love yourself.
Good afternoon. My name is Dr. Bill Salisky. I'm a pulmonary and critical care doctor, and I guess we've heard from public health, elegant, from my esteemed colleague from the clinical standpoint, and I'm here to represent the frontline critical care doctors and nurses. As I briefly said yesterday, our hospitals represent what has happened in the community. So I'm here to tell you that we are busy, we're full, we are not overwhelmed. Our administrators at our facilities have prepared for this and prepared well. Our government has backfilled us with almost everything that we need on a regular basis, including remdesivir. However, we are getting stretched, and looking at the numbers every day worries us. We can't keep this up. So, anything that we can do to stem the tide, or if you will, flatten the curve, is important. The CDC feels it's important that masking is done. Obviously, we should learn from our brethren across the ocean because they've been masking for years. It is successful. The mayor knows that. And so does Mr. Calhoun, obviously, and we applaud them. The masking, however, is just the beginning. The masking represents an effort on our population to say, hey, I'm masking, I'm going to stay 6 foot, I'm going to clean my hands when I can. The folks that you see that aren't masked, you wonder, what exactly are they doing? You know, what's happening there? And again, civil liberties aside, we are in this together, and we need to fight this together to win. The numbers are overwhelming, they're worsening, and if we don't stem this tide, I'll be here begging for a stay-at-home order if we're not careful. So I applaud our government for reaching out. Now the next step is education. We need to get into the communities. I even last night woke up, I too spoke with my wife, and we talked about different efforts, things like having the people that are doing the census turn them into COVID workers for us. Anything we can do that we can stem this tide to educate our public. There are people out there that just don't believe this is a problem. They don't, until it affects them. We had a group come in this morning to Jackson Hospital. Didn't believe it, no social distancing, and that group's in trouble. And I can go on and on with the stories. People who don't seek medical advice in a timely manner. When people become sick, as the doctors pointed out, they stay home, they self-quarantine, and they call their doctor. That way we can get to them early. We have people that come in 8 to 10 days into the disease process. I can't help them. I try, I hold their hand, I give them what we have, but I can't help them. So education, recognition, social distancing, and these masks. So I'll be brief. Thank you very much. And Mayor, again, Mr. Calhoun, thank you so much for your efforts. Thank you.
Councilman Calhoun, Councilman Mitchell, if you all would like to bring any words at this time, I'd love to hear from you as a sponsor of the ordinance and as one who supported the ordinance.
Thank you, Mayor Reed. I want to thank you for your leadership off the top for leading your executive order. I want to thank this professional medical team that came out last night to try to help us with this ordinance. I want to thank the council members that supported it on last night. And my friend Glenn Pruitt, thank you, man, for really considering and having a talk and having a change of heart to even just think about as we go forward, because it's all about safety and helping Montgomery. And so as we go forward, we ask that you do wear these face coverings and do what these medical profession has asked us to do, social distancing with the holidays coming up. If we do what we're asked to do, we'll get through this curve and we'll get back to normalcy. But again, I want to thank this team for doing what you needed to do to move us forward. That's Montgomery. Thank you, and may God bless you. Stay safe.
I'd like to also thank the mayor, thank the doctors. Also like to thank Montgomery. We heard your voices. I got numerous emails, telephone calls, on social media, and this is what it looks like when you actually listen to the people of Montgomery. So we listen to you. So it's what I say to Montgomery, now it's time to mass up. Thank you so much, Mayor.
We also have with us our EMA director, Christina Thorne. I want to thank her again for the work she's been doing. She's been doing a fantastic job of making sure that we stay on top of our supplies, that we stay on top of our resources, and we distribute those to the community while also keeping us abreast of all the changes and updates that are coming down from the Department of Public Health. So we want to thank her again for her leadership. So I want to just close out by saying that what we're asking to do, everyone in this city, and I would even ask those who do not live in the city, who we do not govern, to consider wearing a facial covering when out in public. This executive order will go into effect at 5 o'clock on Friday. It is not designed to be permanent. It is designed to be a carryover, if you will, until our next council meeting where we can reevaluate the ordinance that was brought up last night on July the 7th. And so this is something that we hope in 3 weeks, if everyone will do their part, we can see some better numbers and we can see some progress. And at that time, we can start planning ways to get into the next phase of our reopening. But as long as we're on the trajectory that we have right now, it's hard to do that. And so that's why I decided to sign this executive order, and that's why I thought it was needed. And again, I am just very proud of Glenn Pruitt, our council member, for reaching back out, having some second thoughts about his vote, and seeing how we can work together. And we believe that with that support, should this come up at the council meeting, we'll be in position to move forward. But again, our goal is to ask people to wear a facial covering anytime you're in public, to the degree that you must go out. We'd like for you to stay at home as much as you can, but to the degree that you must go out, we want you to wear a facial covering. And the executive order covers anytime you're in a space of 10 or more people. So if you are with a family member, you're in a car, that's understandable. If you're at the park, we understand that. But it is more so to make sure we're protecting our neighbors, we're protecting our friends, and we're protecting those frontline workers, those people that we cheered just months ago in the grocery stores, in the retail stores. We're asking our private partners to help us enforce this. We're asking our private partners to make this a part of your practice, just temporarily, till we can see some progress in these numbers, and so we can ease some of the strain that's on our medical professionals and that's on our healthcare system. It's very, very important that everyone participate in this if we want this just to be temporary. And believe me, as the mayor of this city, as the city council knows, we need things to be back to normal because our government works off of taxes. It works off activity. It works off of small businesses providing services and interacting with the community. So we want all of those things, but we cannot put that over the health of our community. And we've just reached a point right now that we have to do something, and we believe this is in the best interest of our community. And so I want to thank all of you for helping us and doing your part, for those who've been wearing masks, for those who are just getting used to it. We hope that you will continue. Again, city councilmen all have been distributed with masks that we'll be giving out throughout the upcoming days, and we'll make sure that we partner with any private retailer or any small business that needs help. You call us, you call our 311 number, and we'll make sure to get that information to you, and we'll make sure to get you some supplies should you need those for any customers that may come in, because we want to not only protect you, your staff and your team, but also each and every person in this community that may not have access to getting that. Finally, I want to thank this entire community for all the support that you provided during this pandemic. This has been a unique experience, and one that I'm sure most of us will never forget, but we are not done yet. We have not won the battle, and we cannot fast forward to the end of this. We have to continue to remain vigilant. We have to continue to show resilience in the face of this challenge and make sure we do everything we can to stay safe and to keep our loved ones and our neighbors and everyone else safe as well. Thank you very much, and that will conclude our announcement.